Good morning. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, and I'm bringing to you all things health related for women. Thank you for joining me at the corner today. And today I am doing a quick part 2 on hypertrichosis. So as I'll refer to the previous presentation because I have a lot of information in great detail on the previous presentation. But just to do a quick recap, hypertrichosis comes from the Greek, hyper, which is too much, trichosis, which is growth, so it's an overgrowth of hair. There's 3 different types of hypertrichosis, and they are, I guess I should backtrack for a second, that there's two different types of hypertrichosis because you can divide it into generalized and regional. So obviously generalizes the whole body, and regional will be specific specific areas of the body, like just the back or just the chest or just a small spot in the elbow, something like that. And then there are 2 different ways that one can have the phenomenon or the malady of hypertrichosis, and that can be either congenital, which means you're born with it, or it can be acquired, which means something that occurred in your environment or you ingested caused the effect of the abnormally increased growth. Now, there are 3 different types of hair growth because there are 3 different types of hair. So the first type is lanugo, and that's the hair we see on unborn babies, premature babies, and neonates, so very soon after birth. It's a very thin, long, fine, almost translucent hair over the entire body. A lot of times it's much more prominent or much more visible on the face and on the back. And then there's vellus, which is the type of hair all of us have on our arms, our legs, and sometimes you'll see it just on the belly or on the back, but just kind of normal colored hair, but more like a peach fuzz type of hair, and it's very short and it's soft. And then there's terminal hair, or what in GYN we often call androgen-dependent hair, or secondary sex hormone hair, because it's hair that responds to testosterone, and it's post-pubertal hair. So it's the hair that develops after you've gone through puberty. So it's going to be a beard, mustache, facial hair for men, underarm hair, pubic hair, genital hair, and the surrounding areas. So upper inner thigh, lower abdomen for men, and then chest hair for men. So those are the different types of hypertrichosis. It's different from hirsutism because hirsutism really just refers to women who have or are in the process of developing male pattern hair growth and hair loss. And that's it's a different subject topic for a different day. Now, what I left off from the last time, and I wrote some notes down here so I wouldn't forget, if I can find them, is that hirsutism, I went over congenital hirsutism, and I'm sorry, I don't know why I keep saying hirsutism. I went over congenital hypertrichosis, and that was basically 3 different aspects of congenital hypertrichosis. And that's the hypertrichosis lanugonism, and that is basically that lanugo hair just develops pre-birth and then it continues. And then the hypertrichosis terminalis, which is an abnormal growth of the peach fuzz hair, which is basically the werewolf syndrome. And then there's, I'm sorry, not of the peach fuzz hair, but yeah, just of the body hair, which is the peach fuzz, but it becomes thicker, stronger, and coarser, and it's the werewolf syndrome, which is probably where the werewolf story came from. And then there's the nevoid hypertrichosis or hypertrichosis nevoid, and that's where you have basically a nevus, which is a mole or change in the skin, and either increased pigment discoloration or change of the skin, and then you have excess hair growth from that one spot. And that's often moles, and they're often on the trunk, so the back or the belly. And I spoke, so those are congenital, and then last time I said I would speak about how they can be acquired. So predominantly acquired hypertrichosis really just breaks out into either the lanugo or the terminalis. Lanugo, most commonly, if there's an increase of the lanugo hair, that's going to be a sign of either nutritional malnutrition or nutritional deficit. So it's common in severe bulimia or anorexia nervosa, or just severe malnutrition due to environment. And it's thought that perhaps that occurs because when you're malnourished, you don't have all of the subcutaneous fat that you're supposed to have to help keep your body warm, or the brown fat, which helps generate heat. And it's thought that maybe that lanugo hair helps to increase the heat, trapping of the heat and body warmth for the core. Also, that increase or hypertrichosis of the lanugo hair often occurs with cancer development. So if someone does not look like they're malnourished, they're not abnormally losing weight, then there should be an evaluation for a source of a malignant source, so for a source of cancer. And the most common cancers that will increase that lanugo hair growth, as far as women are concerned, uterine cancer, and sometimes certain types of breast cancer. There are a variety of different types of breast cancer. And then just in the general public, certain types of colon, lung cancer, and prostate cancer. The increased growth of the lanugo hair can be seen up to 2 years before it's evident, or there are signs or other signs or symptoms of that malignancy present in the body. So it's very important to follow up on that. An additional source of that increased lanugo hair can be severe HIV or even AIDS development, and different types of thyroid disorder, especially juvenile hypothyroidism. And then the lanugo and the terminalis increase hair growth. More commonly, terminalis is in the face of certain drugs, such as steroids, certain types of hormone replacement, kidney treatments, even epilepsy treatments such as phenytoin, and popular medication for certain popular medications for hypertension and corticosteroids, and definitely, or kind of obviously, but it has been seen, abnormal response is medications for hair loss that are just supposed to be applied in a small amount on the scalp. If too high of a dose is applied, or the person goes nuts trying to apply a whole bunch of medication for the scalp, they can actually get a really increased blood absorption of the medication, and then they'll have increased hair growth of their entire body. So those are all acquired types of hypertrichosis, be it the lanugo form or the terminalis form. Now, unfortunately, if there's congenital hypertrichosis, there is not a treatment to arrest or to retard or to stop the development, the constant growth of that congenitally acquired hypertrichosis. The only treatment would be the hair removal. So that would be laser hair removal, or the epilation, electrolysis, or occasionally, sometimes the creams will work, Benico as an example. If it's acquired hypertrichosis, then obviously just addressing the source of why it was acquired is going to be the method to stop the continued hypertrichosis. And then to eliminate the hair that's already developed would be the laser, epilation, electrolysis, Benico, all of those methods of treatment for excess hair. So I hope that's been helpful information on hypertrichosis. And then the next presentation, I'll speak about hirsutism, which is still it's excess or abnormal hair growth, but it's a different source. So thank you for joining me at the corner today. If you appreciate the presentations, please make sure you hit the like, subscribe, follow button, give that thumbs up. And then please use the comment sections to suggest future presentations, information topics, things that you'd like to hear. It's all things health related to women. And make sure that you check out not just the Facebook page, but the YouTube page. It's also GYN Corner. And the podcast, we're on all of the platforms, Spotify, everything, Google, everything. It's GYN Corner. Have a great rest of your day. Bye.